because that's one of the things we're trying to do is create an archive of these very interesting seminars that we can make accessible and et cetera, et cetera. So we are doing that now. I'm going to go ahead and just call your first name on the screen, and I'll finish with you, Tyrone, but and ask you to just very, very briefly, say who you are, where you're located, and if another sentence is appropriate, go ahead. If not, that's fine. Ali Reza.
Hello, everyone. This is Ali Reza Ibrahim Mandi. I'm a data scientist at UC San Francisco, and I'm located in Rockville, Maryland.
Deb, go ahead.
I'm Deb Polk. I'm a psychologist at the University of Pittsburgh School of Dental Medicine. And Ali Reza, I grew up in Chevy Chase.
Great.
Shreya.
Hi, I'm Shreya Sontalia. I'm a first-year PhD student at the University of Glasgow.
Naveed.
Hi, I'm Naveed Gaffarzadegan. I'm faculty member in Virginia Tech Fall Search Campus.
Jack.
I'm Jack Homer. I'm an independent consultant, system dynamics modeler. Live in the mid-Hudson Valley of New York.
Gary.
So I'm Gary Hirsch. I'm also an independent consultant applying system dynamics, largely in healthcare and other social issues. And I'm located in Wayland, Massachusetts, which is about half an hour west of Boston.
Ashish.
Hi, I'm Ashish. I'm a research scientist at Duke and US Medical School. Warm regards from a warm city. I'm in Singapore.
Piradon.
Hi, everyone. My name is Piradon. I'm a doctor from Thailand. Now I'm postdoc with MJ at MTHITA, Harvard Medical School.
Douglas.
Hello, sorry, I was slightly late there. I'm Douglas McKelvey. I'm working in the UK, doing mostly system dynamics modeling in health and social care. Hello.
And Hassam.
Hello, everyone. Sorry I was late too. I'm Hassam, and I'm a PhD student at Virginia Tech.
I'm Wayne Wakeland. I'm a professor of system science at Portland State University. And I'm now going to introduce, go ahead and put your slide presentation up. I have Tyrone Keynes, and he's going to introduce himself a little bit more fully and demonstrate a very, very interesting model that is very closely related to our field, but he's bringing a combination, I think, of a systems perspective as well as an economics perspective, although he's focusing his talk on what he thinks would be the most helpful to our group. Tyrone, take it away.
Hey, I'm Tyrone Keynes. I am a production manager at a large plant in Vancouver, Canada. I first started getting into system dynamics to make our supply chain a little more efficient. And over the last few years, I've become converted to the process. So I've now am consulting with Professor Steve Keen on his new software, or it's been out for quite a few years now, Minsky, and we're trying to develop that further and get it out into the community. This model is a module of a larger model that shows the effects of non-pharmaceutical interventions on the aggregate economy and variables inside of it, i.e. interest rates, unemployment, consumption, and many other variables. But this module actually stands on its own as just a pandemic model. So I will just start showing the slides and describing what kind of model this is. The purpose of this model, it is an SIR module of a larger model to show how MPIs affect specific economic variables. As it stands, this module explores the adherence to non-pharmaceutical interventions and the subsequent resistance to those policies. It's driven by exogenous lockdown orders the user uses in the model as it's being run on the fly to illustrate the endogenous public behavior and social stress caused by those policies. Why only present the SR module? The initial goal is I needed something simple for my economic model. As I built it, and many of you in system dynamics, your process becomes more complex over time. And by the end of the process, I had, a standing model for a pandemic that could run by itself without the economic components. Will there be a presentation of the larger model? Yes. I will be presenting what's called the impact on national accounts from MPIs, an economic pandemic model. It will be hosted by the SD Econ SIG and the WPISD Club on March 13th.
That would be May 13th.
May 13th, sorry. The details are listed on the calendar at the System Dynamics Society website. Hopefully some of you can join that because it's quite an interesting model. What kind of pandemic model is this? It's fairly simple. It is a mechanical compartmental model. It is state reset, so as more data comes in, it performs better in forecasting. I've run a few tests on correlation with the data here in British Columbia, and it is quite robust. Like any model, it is wrong, but it does okay with predictions for just being a module of a larger model. The size and composition of the model, it has 26 system states or compartments, 43 flows, 48 parameters, 110 constants, 38 auxiliary variables, and that makes a total of 265 variables. At one point I had probably 500 variables. It became too complex and was not giving me the data I wanted. I sometimes take things a lot further than they should go, but I did manage to tone it down and keep it simple, and that's where we stand with the size of this model. One of the things that I really like about the Minsky software is its godly tables. Minsky was designed as a system dynamic program dealing with the aggregate economy, and it uses a set of tables that are stock flow consistent and are based on the accounting, double bookkeeping accounting, and how all your lines should equal zero if your accounting is correct. Godly tables were developed to enable monetary modeling, but that's not all they can do. The basis of Win Godly's modeling is the basic idea, pardon me, that all financial flows start somewhere and end somewhere, making it feasible to model processes where there's an exclusive transfer from one location to another. This is highly relevant. This is a highly relevant instance of this is the COVID-19 pandemic. You either have COVID or you don't. You're either in the hospital or you're not. The various positions someone can be in with respect to the disease are mutually exclusive categories. If you're in one category, you have to leave another. So inside of Minsky, I prefer this method of modeling versus pipes and boxes and valves. You design a table, you have your stocks running horizontally at the top or compartments, and then you have your flows running vertically along the side. And inside each cell, you have a red variable and a black variable. I don't know if my pointer is on in this presentation setting. Yes, okay. So for instance here, if you get exposed, you leave your susceptible compartment and you enter your exposed compartment. And later on, these variables are defined directly on the canvas, which I'll show when I'm showing the model. What is the feedback perspectives of this model? Because I'm dealing with MPIs, there is different reactions in the public. And I just simply named it public social perception. And then what feeds into that is your daily case counts, hospital capacity, deaths, stuff that impact the social perception. Social stress being one of these areas. There is a model out there, a compartment model style called the SIR social stress model. So I used elements of that, and basically there is a feedback effect in this model where people stop following MPIs over time, depending on how many there are. I also have another feedback. I called it the individual positive behavior. Basically, there's a segment of the population out there, I'm one of them, that if I see negative news, and we'll just use COVID-19, hospital capacity is at its limits, I make sure I keep distance from people. I wash my hands, I wear a mask. I don't do that because of public policy. I do it because it's morally the right thing to do. And there is a large group of people in our population that behave that way. So that will counteract the social stress, the group of people that just become tired or fatigued from all the lockdown measures. I have the MPI policy, which is exogenous. The user sets it themselves in this model. You can do it on the fly. You don't just start, set your parameters, and then see what happens. You actually run the model and you can change your MPI policies as you go. It has an interesting interaction with the endogenous behaviors of this model. The MPI policy makes up the Stringency Index. That obviously drives the social stress. If the index is higher, people become more fatigued over time with MPI policies being in place. I have a very small vaccination segment of this model. Essentially, when I run it here in a few minutes, when I start my vaccinations, it's one parameter. Let's say I set it at a 10% rate. That means 10% of the population over 3 months will get 2 shots of the vaccination. I know I could expand that, but that wasn't the point of my model. So when I am running it, you may see that and wonder how it's working. And that is how it works. So this is the feedback dynamics of my model, and it pertains to the MPI policies. If you look at the lime colored variables, that comes directly from the stock and flows. And these are some of the variables that influence public social perception. The first negative or balancing feedback loop, of course, that affects individual positive behavior, which in turn affects the exposure doubling time. So as the doubling time goes up, there's less exposure, there's less cases or incidents of the virus in the public. Another feedback, which is starts in, from an exogenous perspective is your MPI policy. As you set it during the model, while it's running, that affects the stringency index, which again exposes the affects the exposure doubling time. That's another negative feedback effect. Also, what's happening at the same time is people are becoming stressed out from being stuck at home and having to order in their food and not go to restaurants. This is a reinforcing or positive feedback loop. So as people become more stressed out, the exposure doubling time goes down and more people are exposed to the virus. One thing that may be a subjective view on my part is the vaccination policy. There was a huge expectation when the vaccinations first came out that this would solve all our problems. It would be the silver bullet. And when I say we, I mean the general public. I'm sure academics realized the limitations of the vaccination policy when it first started. But generally, and myself included, I had great hope that, hey, everything would be okay. And what happened is people became even more fatigued because they got their shots. The pandemic was still happening and they were still under lockdown conditions. So that fed into the social stress aspect, and that's how that positive loop works. Real world data. So I'm from Vancouver, Canada, and British Columbia. So as I was building this model, I tried to collect as much British Columbia data I could. And so we don't have a published stringency index here. So I had to gather all the lockdown measures myself, add them up into aggregately add them up. I multiplied the blue line just to give it good perspective with the active case red line. This is my belief that MPIs have been driving the waves of this pandemic more than the different variants of the virus, and that would be an on and off effect. Right now, these are just two lines, and you could just say, well, it's correlation. One would drive the other, or the other drives the other one. But one very simplifying assumption is when you break the chain of the virus being spread in the community, that is a causal effect. You can't deny that. If you are separating people and the wave is in decay, I would say that's a strong correlation or a strong causal effect. I'm comparing that to my model data, which took some time to calibrate all the parameters. I now stand kind of at that shape. It's very similar to the real world data. I could definitely improve that a lot. But again, my focus was on a broader model for the economy, and I felt this was pretty good. Areas of improvement or expansion, there's lots. I am not in the healthcare field. I'm a production manager. So I'll list a few. The social behavior, when people go to get tested, I do have that function in my model, but it's very simple. It could use a lot of work. You know, if there's anybody out there that has some ideas around that after I show the model running itself, I'd love to hear them. Add more cohorts. Right now, as it stands, my model has 3 dimensions. Your first-time infections, people that have recovered and get the virus again, and people that have been vaccinated and get the virus again. I felt that was sufficient, again, from my larger model, but obviously, you can add more flavor to this model by having age cohorts or gender cohorts. More feedback dynamics. I've, over the last 3 years, I've come to really enjoy anything to do with system dynamics and any type of model in any field. So there are many areas where I could add feedbacks outside of the MPI policies. Again, I felt at this point it's sufficient for what I need it for. And better vaccination parameters. As I said before, it's just the one parameter to start your vaccinations. I imagine having some people get vaccinated instead of their second vaccination being 3 months, it's 6 months. That would cause a whole new dynamic in infections that I'm not exploring. And finally, I'm using the Minsky system dynamics software package. It right now is in development. It's free, open source. It was created by Professor Steve Keynes, who I work with, and it was coded by Dr. Russell Standish. It's available in SourceForge to check it out if you want to. And I also am running a weekly show basically on tutorials on my YouTube channel on how you can use Minsky, not just in economics, but to model many different things. And that concludes my slides. So I will go on to show the model itself. This is the interface in Minsky. It's a little bit different than VinSim. It's actually quite a lot different than VinSim or Stella or PowerSim.
Tyrone, we need you to reshare differently so that we can see what you're showing us now.
Oh, right, sorry.
No problem.
There we go. That should be working, correct?
Looks like we're in Minsky, yes.
Yes, perfect. All right, so again, like I was saying, it has a different interface from most system dynamic programs. In most SD programs, you click on your box, your circle, and you do your equation inside of that. Minsky, you're wiring your equations directly on the canvas, and I'll show that in a second. But I'll just run through the different modules of my model just so you get an idea of the interface in Minsky. These are my system parameters. They're simple, again, because I'm not in the healthcare field. I have, days in each compartment, the percent that recover or go to quarantine, vaccination breakthroughs, recover after you've recovered and you break through. This is the part where you take the real world data and hopefully it's accurate, and you feed that data into my model, and that's what comes out. The Godly table, again, I was showing this in the slides. This is really useful in modeling monetary flows, but again, because these are mutually exclusive categories, it's useful for a compartmental model. Stock flow diagram. Again, this is a part where it's quite different from other programs. You wire your equations directly into the canvas. So you have your operators directly on the canvas, and then you wire your variables together. Because I'm using the Godly table, I don't have to wire my flows to my stocks. That is occurring inside the Godly table. I created some lines here to show the causal effect of moving through the different compartments. This is, I love math. So this way for me is great because I'm seeing the math as I build the model. For some people, it might not be their thing. This is a rather complicated feedback effects that I built using, well, a lot of switches. In Minsky, we use heavy side switches. So basically, you can switch something and get a different output. And these happen to be my MPIs that you set. I could probably spend an hour describing all this, but we don't have that time. I do have a automatic season change in this model between winter and summer. It has a minor effect when cases are low, and it's not noticeable when there is a huge wave happening, which I find is quite similar to the last 2 years of the pandemic. One thing that might be a little bit controversial in system dynamics is I had an idea that a policymaker would use this model, and I didn't want a nice bell-shaped curve to my waves. I wanted some chaos to it. So a policymaker would have that feel that he's dealing with real world data as he's running the model. So I use the Lorenz system, which creates chaos, and I applied it throughout my model. You could turn that off or turn it on. It's just something I like to have. My social stress behavior aspect is actually a stripped down predator-prey model, which is kind of interesting. There was many ways I could have modeled that. I used some exponential functions for my lockdown behavior. So if viruses or if cases are low in the community, there's not much individual reaction to washing hands, etc. But as it goes up, that process of washing hands or taking care of yourself, doing your part in society to prevent the spread grows exponentially. Finally, I've created, this is my dashboard. This is what your interaction with the model. I'm just going to start running it and kind of talk as I go. So I'll set it on slow. So we can make policy decisions as we go. Right now, again, this is data that I used from British Columbia, all the parameter settings. I've looked at other data across the world, and it differs either because of data collection or treatment methods. There could be any number of reasons. So this model has cases that are undetected, which are happening right now. And now we are getting our first case. Our first case in BC was on the 28th of January. I'm running in days in this model at 40 days now. There was no public policy until about March 1st. So we'll just start. I'm not going to do these in any specific order. State of emergency for the province, federally a state of emergency, travel restrictions, gatherings will go 10 people or less at this point, government shutdowns, gatherings, we'll restrict those, social distance policy. I believe the school shut down around this time, personal services, restaurants. Over here, I think all our faces are kind of covering it. We'll try to move over so it can be seen. We have our social stress over time, people's their tolerance to the pandemic, the red line, and then the green line is the intensity that people are washing their hands, taking it upon themselves to do their part in stopping the spread of the virus. This would be what you see in the World Data website, your Stringency Index, and that's just based on the exogenous policies that I'm implementing myself. Around this time, as I recall, personal services reopened. BC, we let the schools go back in June, which would be day 150. One thing Minsky was originally designed for, it was dimensionless in time. It's only now that it's going to be added where you can have days and years. Right now, it's just a number up in the corner. And as I said, Minsky's still being developed. There are lots of little things that can be improved. One thing that I like is you can embed your plots right on the canvas and wire directly to them. So as you're building a model, you can test what's happening visually. We'll let school back in. Restrictions are gradually released. We'll go 50 people or less. Interprovincial travel restrictions are lifted. Everything's looking good. As we know in retrospect, it wasn't good at all. And we had border closures. We'll open restaurants. And again, I'm not doing this in any particular order. I'm just reacting to what I'm seeing as data being outputted in the model. Schools shut down for the summer. And we're beginning to see our second wave. We're seeing hospital capacity. One of the things is I looked at data for hospital capacity in BC, and we essentially had 1,800 extra beds that we had space for COVID. So the gray shaded area in hospital conditions is the capacity, and it changes by itself as people being admitted to the hospital goes up. You can see the social stress. People are beginning to get tired, and that feedback is when I do my exogenous policies, they become less effective over time because less people in the population are following those policies. That is the joining of the exogenous and endogenous feedback effect in this model. Again, people are seeing that the second wave is growing. People on their own are reacting to that, washing their hands more. Again, we have this on and off effect. We'll go to 10 people or less. We'll completely restrict gatherings, nightclubs. In BC, it took until October of the first year to have mask advisories, and then finally mandatory masks, which was baffling to me. I probably chalk it down to the lack of masks being available for use. It took quite a long time here to implement that, and I guess that was like that everywhere. We're approaching the first year. This would be a little bit early for vaccinations. At BC, it started January 1st of 2021, but I'll start it now. And like I described before, I'll set it at 10%. That means that over the next 3 months, 10% of the population will have received 2 shots of the vaccination. The dynamic of that is it takes the vaccinated people get removed from either the susceptible compartment or recovered susceptible compartment, and they go into a vaccinated compartment. And they stay there for a set amount of time, and then the vaccination wears off and they go back into susceptible. That's the effect of that. When they go back in as a susceptible person from being vaccinated, one of the dynamics I had is that they're less likely to have a severe illness. So as this model goes on, you'll have big waves, but the ICU, which is the red line in the current hospital ICU, won't be as high. That's something I've seen in the real world data. I guess a lot of that would be the different variants affecting that, but in this model, I stayed away from the deviations of the different variants. But anyways, that's a model. I could go on for 2 years, but it's just more of the same. The only difference is you'll see is a huge spike at the end as recovered people and vaccinated people become susceptible again. And there are no booster shots in this model. There is a huge spike, but in that spike, there are less people in the ICU. So that is my model.
Very, very, very interesting. As you showed this to me a few weeks ago, I kept thinking, I could imagine a pretty high level person actually watching this wondering, am I making the right decisions? And so part of the reason I was really excited that you agreed to come and talk was that we desperately need more showmanship, if you want to call it. And I think you're providing just a little touch of showmanship here to a very good effect. And I'd like to just open it up for questions and comments from everybody. Let's try the free-for-all approach rather than raising your hand and somebody trying to call on you. Let's just see if we can, there'll be a few interruptions, but I think it'll be fine. So I'd say just jump in if you have a comment or question.
Just a point of clarification. So in your slide, you were showing feedback loops. The government side wasn't inside the feedback loop in your model. It was exogenous. So we used the term exogenous to refer to what you were actually doing when you were presenting the model. Somebody's changing things.
Yes.
Endogenous is when it is inside a feedback loop.
Yes.
It's just a term.
So in that causal loop diagram, I did list that the MPI policies are exogenous.
It made it drew that feedback loop. So
because it is integrated. Like there is no way of getting around that. There is user activated policies in this model. That is part of the real world. There is a person out there, a policymaker making those decisions. So I did put it in the CLD because I thought it was important to see that effect, that there is an exogenous interaction.
That's true. I mean, in the real world, there is that link. In the model, there wasn't that link. That's what I'm trying to clarify. But yeah, I see your point.
Which brings up this very interesting question. Can we model policymakers? Could a module be added that was called the policymaker model, and you would start to endogenize some of these pieces, maybe not all of them? I think that would be super cool, actually.
You could, and I thought about doing that. From my perspective, it would have took the fun out of running a model. And again, if this is actually a demonstration model for Minsky, but if I was going to a decision maker, I'd want them to be able to make the decision as the model runs, so they have an understanding of the dynamics of their choices now. Will have this effect, but in 3 months, it'll have this effect. And let them practice on a toy model before they go out in the real world and cause damage, potentially, by poor decision making.
Hey, this is Kamel Henderson. Great model. I guess to piggyback off of this idea of adding in politics, I guess the concern I have, given the dynamics of politics in the US and not necessarily Canada, a lot of these things are not necessarily driven by logic per se, but if you can get enough votes and et cetera, and I can say that our initial pandemic response. Under one administration, sort of hindsight looks like there was some issues that are related to trying to get votes and not necessarily logical steps to addressing the pandemic. So just curious, like, how would you even model that if that was the case? So.
Well, as it stands right now, the only thing in the model, if I had run it longer, was the social stress aspect. You could look at that as some way you'd have to respond to that politically, as that stress level or adherence degrades in the model. If you wanted to stay in power as a politician, you simply can't have all these lockdown policies. So again, you could model that from an endogenous perspective. I'm sure there are ways.
I want to thank you, Tyrone, for your presentation. Especially enjoyed seeing the Minsky software and the idea of changing parameters on the fly. It's pretty cool. You don't have to stop and start again. So that's something new. And I don't really want to put you on the spot. This is more like a challenge to our whole field, which is that, we're more than 2 years into the pandemic now. Starting just very early on in 2020, a number of us started modeling COVID and playing with various behavioral feedbacks and also bringing data to bear. We have a COVID resources page at the System Dynamics Society website. So I guess it's a question, it's sort of a challenge about reinventing the wheel. At what point, and you mentioned the fact that you weren't a healthcare professional, and even those of us who have a lot of background in healthcare didn't necessarily know how best to model COVID. Nobody knows exactly which feedback loops should be built in, but we can share from the trial and error and learning that's taken place. So I would hope that like other social sciences, we can build on the foundation of what's been done before. It would be unfortunate if anybody who is interested in, let's say, building COVID dynamics into a larger model of the economy would have to start from scratch and do it, that way every time we build a model. So, I'm just sort of expressing a hope that somehow we can get together and decide, here are features that work and are significant, here are other features that seem superfluous, and we don't have to worry about those, even to the point of estimating parameters based on what other people have discovered from their modeling. I would just like to see us not have to reinvent the wheel every time. That's my opinion.
So there was a good article to that effect. I think it was in JAMA, maybe, yes, today, talking about just with the same problem occurring with COVID trials, right? That there were a lot of very small trials, underpowered, all looking at exactly the same thing. And the author had a number of recommendations in that article for sort of policy changes at, I think it was FDA and CDC in that case, for, well, what kind of trials will be acceptable, right? And trying to get more sharing and a better understanding of what everybody is looking for. So it's not unique to our modeling.
So Tyrone, when you got started, how did you begin spinning up enough to begin to build your model, which ends up having a lot of pretty fancy features and a lot of things that, I heard you mention predator prey models. I heard you obviously mentioned SIR models. How did you learn what you thought would get you going?
a little bit from Professor Steve Keen. He, a few years ago, attempted to build a 5-compartment model, the SEIRD model in Minsky, and he never finished it. So I took that model and I finished it and ran it, saw the basic dynamics. If your alpha or the exposure rate goes up, or the doubling time, the time constant, less people become infected. And I went from there and just started adding other dynamics that I've learned over the 3 years that I've been practicing system dynamics. I am a big fan of using equations. I don't know why I think this way, but if I see an equation, my mind goes into bizarre places. For instance, the predator-prey model, which is stripped down. It's not quite a predator-prey model, but for some reason, that's what I need for social stress, and I just apply those mathematics to it. I don't know sometimes how I get to that, other than I have a problem and I know all these techniques, I know all these chaotic systems, and I apply them, and then I tweak it afterwards. And as everybody in here knows, it's an evolutionary process. A lot of times I didn't know the pandemic portion of my model was going to get so large. I knew I needed something robust enough that it would affect economic variables in the larger model. But I didn't plan on having 265 variables. And then, yeah, at one point I had 500, and it became very hard to manage the output in that model. So I had to tone it down a bit.
Can you imagine that, in years hence, people will figure out how to boil down these complex models to their core essence, kind of like the firefighting models in new product development got boiled down by some really sharp people to a pretty simple structure that you could learn from. And it seems like we might want the same kind of things to go along with COVID modeling. Is I think kind of we expect that nobody's going to build the elegant, perfect, simple little model on day one of learning a new subject. And I think this is, I feel like you're sort of in that same mode. There's probably, you know your model. Quite a bit of what's there has to be there because people talk about it. It may not be that big of a deal, but it has to be there. Otherwise, people will think you're ignorant and not listening to all the news. And so you've got kind of, but as you become better known in this field, and you will, you could be in the position to help shape our more, we are always told, and for my whole career, I've always wanted to try to build simple models, but my models end up being more complex. Just like it happened to you, it's happened to me. I bet everybody in here knows that same feeling of models getting out of hand, and it takes more years of knowledge and experience. And I think what Jack is saying, us working together so that we can learn at a higher rate of speed, because there's a whole bunch of us engaged in the game and we're sharing and working together. I'm just pontificating right now, but
yeah,
feel free to respond.
I totally agree with that. There's one example is people getting tested in my model. There's no need for that. I don't have any function beyond that, other than I know that I'm presenting this to a group of people that are pretty high caliber in the healthcare field. So there is that pressure to have those elements to show, hey, I know what's going on. And yeah, I completely understand that perspective.
I had one question. I was curious, when you were talking about social stress, I think you mean the same concept that's sometimes referred as COVID fatigue.
Yes.
So what was the analogy between that and prey and predator model? I didn't get that, like why you use.
Okay, well, this is the bizarre part of my thinking is the declining, like you saw the shape, the red line in that model, that is the predator not having enough food, which is the exogenous policies. It's a little bit backwards, and I could have modeled that in a lot of different ways. I only mention that because somebody may have noticed that is a stripped down predator-prey model. I could have had a stock and depleted it in any different way. That's just the way I operate when I build models. So that's the relationship to it. There's nothing deeper than that, other than I use that mathematical equation for the social stress auxiliary variable to decay over time. It is essentially the predator dying out because there's not enough fish to eat. That's all. That's all it is.
We love analogies. We couldn't possibly be model builders without them.
Something that occurred to me while I was watching your presentation, Tyrone, and others was that early in the pandemic, I built a Stella model really for my own. I mean, we probably all built our own models, and I found that if I put a number of exogenous, I think you might say, factors on switches or on sliders, so you could have policies that, this would be a really severe lockdown, and this would be a sort of gentle lockdown, and this would be somewhere in between. So without going into the detail of whether it was schools or shops or mask wearing, just, and also things like compliance and so on, that by running the model one day at a time and looking at what was happening and then changing these switches, which was very similar to what you were doing, then, I mean, clearly what you got was the oscillation between infections growing and infections falling, and then government trying to ease restrictions, and as they eased restrictions, so the infections would rise again, and so what would happen would be the different shape of the oscillations. Familiar things to all us. But what I didn't get very far with communicating that model to anybody. Where I am in Edinburgh seems to be full, and I suddenly discovered that Edinburgh was full of epidemic modelers, but they weren't using system dynamics, and nor were they particularly interested in what I was doing, and then I had other work to do that I was getting paid for. So all these things, but the one thing that the idea that occurred to me is that there's lots of ideas. I sometimes struggle with the concept of what should be exogenous and what should be endogenous, and in system dynamics we prize endogenous phenomena. We prize it things when the system causes other things to happen within the system, but there always has to be some kind of exogenous thing as well. I mean, for example, in the pandemic, I don't think anyone, well, I guess a virologist could have predicted that there would be further variants, and that all of a sudden there would be a variant that would become much more infectious and much more dangerous, and then later on there would be a variant that was even more infectious but much less dangerous, and all these things. I don't think you could come up with a model that would generate that. However, what it did occur to me was that this way of using a model of one day at a time and then changing the switches introduced, whether you call it exogenous or endogenous, a feedback loop that we don't pay much attention to, which is the feedback between the model and the model user. And that's kind of what you've shown us today, that actually here's a model, it's doing things, and there's a feedback loop between what the model's doing and what you're doing, and then what happens next. And I think that, I don't know, maybe somebody should write a paper on that, but in terms of what Wayne said earlier about ability to present models and make them accessible and engage people's interest, I think that you're certainly onto something. And So that's my contribution basically.
Yeah, isn't that interesting, you know, to think of yourself as part of the model, the user themselves. And then in that sense, you become endogenous to the system because you are a variable. So that's an interesting viewpoint.
It's really got the same quality as the beer game, where people, wouldn't imagine making the stupid decisions that one makes with the beer game, but when you're given the opportunity, you make those mistakes. You contribute to the oscillations that the system is having, and then you learn something from that. So I think having the options to both make the policies endogenous or exogenous to be able to involve the user is a nice option to have.
It makes me want to get and try Minsky out. I mean, it looks really intriguing. It's a different perspective. It's got enough connection with what we do kind of primarily with our other tools, but it gives us a new, it's really difficult to build large compartmental models in most of the software. Everybody in the system dynamics world has tried to provide features, whether it's using vectors and matrices and index variables and all those other kind of things. None of them are very easy to use. I'm probably guessing Minsky takes some learning as well, but the idea of being able to have reliable variety in the structure, and but we don't know if that's going to end up giving us deeper insights. We very often find that a fairly simple model can give us insights very similar to the more complex version. But I don't know that we know how to choose. Just like you were saying, as you're on the journey, got more complex, then you had to pare it back down. I'll bet you in the coming months and years, you'll be able to pare it down further and further. And that may improve its impact potentially, because people won't have to be intimidated by the complexity. Go ahead, someone else.
I wonder also whether there's a way of putting like an interface on the interface, so you can engage a much larger group of people. I suspect for a lot of people, the interface we saw would be somewhat intimidating, but if you could boil it down to a smaller number of parameters to change, graphs to look at, and so on, whether you can engage more people, because I see a benefit to the general public of understanding how their behavior actually creates some of the oscillations that we're seeing in the case data. So having a simplified interface might be advantageous.
Yeah, at one point I had one parameter just to adjust the intensity of the lockdown policies. I don't know, somewhere along the process, I decided it would be better to have different named parameters, which are named mainly for where I live here in British Columbia and the provincial government policies here. But you're right. A smaller, more condensed interface, I think, is more attractive. And it's probably somewhere, if I do take this model further in the future, which I don't know if I will or not, that's probably an area where I'd go and try to condense things just to make it more appealing for somebody to step in who doesn't even know system dynamics, but could use the dashboard interface and run it.
I'm going to step in now and say thank you very much, Tyrone, for coming and presenting to us. Really, really cool, interesting stuff. I'm going to go ahead and turn the recorder off and sort of give everybody permission to take off. But if people want to hang around for a few more minutes, feel free to do that.
Thank you.